In your morning medical news, the Trump administration is ordering a phase out of petroleum-based food dyes. HHS Secretary Robert F. Kennedy Jr. announcing that change as part of his Make America Healthy Again initiative. These synthetic dyes, common in cereals, sports drinks, and snacks, are already banned in Europe and Canada, where natural alternatives are used instead.
For companies that are currently using petroleum-based red dye, try watermelon juice or beet juice. For companies currently combining petroleum-based yellow chemical and red dyes together, try carrot juice.
The FDA is hoping to eliminate synthetic dyes from the food supply by the end of next year. American women, meanwhile, continue to have fewer babies than in previous decades. About 3.6 million babies were born in the U.S. last year, up less than 1% from 2023's record low. The fertility rate has been declining since 2008, with experts pointing to rising childcare costs and concerns about maternal health care as key factors. Half of all Americans are breathing dangerous air. A new lung association report found 156 million people live in areas failing all three air quality measures. That is 25 million more than last year. The culprit, microscopic particles from dust and smoke that lodge in your lungs and bloodstream, triggering inflammation and potential long-term damage. We know dogs can sense our emotions, but did you know they can actually smell them too? Kirsten Mitchell introduces us to Duke, a Minnesota canine, helping to sniff out stress.
Don't let this sweet face fool you. Duke's powerful nose is at work. The 2-year-old lab is a critical incident response dog with the Burnsville Police Department, specially trained to detect cortisol, a stress hormone in people.
He will basically walk into a room and he'll sniff everybody who's in the room, and then he will zero in on that person who's the most stressed. He tries to get somebody to sit down and pet him. And eventually he'll lay across their feet.
Duke came from Canines for Freedom and Independence, a Texas nonprofit. Like a narcotics dog, he's trained to sniff out stress using sweat and saliva.
It is so much different than the therapy dogs, because these dogs go out in the field. They can go on mental health calls.
Duke responds with Burnsville's behavioral health unit and spends the rest of his time visiting schools or attending community events.
Having him around kind of diminishes that. It breaks down the barriers of being able to work with somebody who is in crisis.
He's helping officers too.
Hopefully we can start to slow down and prevent higher levels of suicide, individuals walking away from the job and resigning.
The question comes up to why do we need it? And the answer is, well, look at him, like it's fun.
And what a sweet face. And the Winona area saw an uptick in whooping cough cases this winter. Early stages of that sickness look like a common cold, but if left untreated, a violent cough can develop, doctors say. Young children are particularly vulnerable to the infection. Officials say cases have diminished as we've entered spring, but it's important to keep an eye out for symptoms.
So what we recommend for anyone is, if they're exposed, call their healthcare provider and get the next steps. And if they do have symptoms, their healthcare provider will definitely give them some antibiotics, and I can often recommend that they stay home until they've completed those course of antibiotics.
Meller says keeping up to date on vaccinations is the best way to prevent the infection.